problem with lung cancer is it is called the silent killer, because by the time you're actually having symptoms, it is too late. So by the time you have any pain, by the time you have shortness of breath, by the time you are coughing up blood, it is likely an advanced cancer.
More advanced stages of lung cancer are less curable.
There'll be somewhere between 160 and 180,000 new cases of lung cancer in the United States this year.
We finally have a screening test for lung cancer, something we've had for other cancers, including breast cancer, cervix cancer, screenings in those diseases that have shown to find cancers at an earlier stage when it is the most curable, and it has had an impact on the survival numbers for those two cancers. The reason lung cancer screening is valuable is because it can pick up early lung cancers when they are at their most curable.
The best way we have to cure lung cancer is to identify it early and surgically remove it if possible.
The people that need to have this screen are those with a history of smoking.
If you have a first-degree relative that has had lung cancer, you're at increased risk for lung cancer. There are certain jobs such as sandblasting and other exposures. We're recommending patients with cigarette exposure, which is the highest risk, but cigarette exposure of 20 to 25 years based on other risk factors to come see us and consider at least a low-dose screening CAT scan to look for an abnormality to try to find a potential cancer and ultimately cure.
The Center for Chest Care really has world-class care right here in Northwest Arkansas. There aren't a lot of multidisciplinary clinics where doctors from many different specialties come together and focus on one cancer like lung cancer.
The benefit to the patient is that all of the physicians who might potentially be involved in their care are present at the same time, and they can discuss the case together and in the shortest amount of time come up with the best plan for that individual patient.
The process of the screening itself is nothing more than a short CAT scan. It's painless, it's non-invasive, it doesn't really take any time to have it done, but it is a highly sensitive test to detect abnormalities in the chest that could represent cancers or other disease processes.
It is reviewed by a radiologist as well as a pulmonologist and the group.
From there, we will decide if we find an abnormality, what the best course of action is for the patient.